So as a reminder, this is an interactive program and it is very much dependent on you. So I want to encourage you by launching into the chat and saying your name and what you do and where you're from. And I want to challenge you to put in one more thing, and there are no wrong answers, which is, what is your understanding of a long-term care ombudsman? And I want to tell you, before I was a long-term care ombudsman, I couldn't even say the word. So no judgment. So drop in the chat where you're from, what you do, and your understanding of what a long-term care ombudsman does. Also, throughout the session today, if you could drop your questions for the speakers in the Q&A, we will have time at the end to respond. And our speakers have generously donated additional time today to get to those questions we don't get to during today's webinar. As a reminder, it is closed captioning is available, as well as the ASL via the Zoom video feed. So this is very accessible format, and we hope all people are able to participate. You can always mark your calendars for these Elder Justice webinars. They are on the third Thursday of every month from 12 to 1, with one notable exception. In December, we have moved it up a week to accommodate what will be all of your virtual partying and connecting with people via social distance. So please be sure to mark that on your calendars. And also remember that they are available after the recordings are available for participants to access anytime on our website. So as a reminder, this is a program provided to you by Ombudsman Services of Contra Costa, Solano, and Alameda, my organization I'm proud to work for, as well as various partners. We have a sponsor of Kaiser Permanente, and remember our planning partners who have come together to make this a success. We have California Department of Social Services, California Commission on Aging, the California Long-Term Care Ombudsman Association, of course, our Office of the California Long-Term Care Ombudsman, California Department of Aging, and Public Authority, Public Guardians, Public Conservatorship Association. Now, I am pleased today to turn it over to the Executive Director of the National Consumer Voice for Quality Long-Term Care. Lori has been a leader in this field for many years and is the expert on not only residents' rights, but also the Long-Term Care Ombudsman Program. So Lori, thank you so much for being here today. I'm going to turn it over to you.
Great. Thanks so much, Nicole. And I'm really delighted to be here with you all today. Thanks for inviting me. What a great topic and what a great time to be with you all. Just to tell you a little bit about who we are at the National Consumer Voice for Quality Long-Term Care. We are a national nonprofit advocacy organization. We have been in existence for 45 years. We're celebrating our anniversary this year. And we work with and on behalf of individuals receiving long-term care and services, both in congregate as well as in community-based settings. We advocate with nursing home residents and assisted living residents. We support and advocate for public policies that support quality care, quality of life, and protection of rights. We empower and educate consumers about their rights and about how to advocate for themselves. We train and support advocates, including long-term care ombudsmen across the country. One of the projects that we house at the Consumer Voice is the National Long-Term Care Ombudsman Resource Center, and we're thrilled to be able to work with ombudsmen across the country at both the state and the local level. And we also promote the critical role of staff and best practices in facilities. We really believe that in order to advocate for quality care and quality of life, you really need to know what that looks like. And so we support staff in all that they do, and we look for best practices on a regular basis. So happy Residents' Rights Month. The Consumer Voice designates October as Residents' Rights Month every year, and this year's theme is Connection Matters. And we felt that it was very fitting to have this theme this year, considering the fact that we are in a pandemic and so much of our connectivity with friends, with families, with colleagues has taken so many different forms this year, since so many of us have had to be separated from our loved ones, particularly those living in long-term care facilities who literally have been separated from their loved ones for more than 6 months now. So we thought it important to focus on connection. On our website, which you see the link there on the slide, you can get a lot of information about Residents' Rights Month and activities that that you can do, as well as submissions that we've gotten in from residents across the country, artwork and poems and essays about what connection and connectivity means to them. So today I'm going to be talking about residents' rights, about how COVID has impacted them, and about a little bit about the work that the Ombudsman program does, and then we'll hear from Joe Rodrigues later on more about that. But as you know, all individuals living in long-term care facilities, including nursing homes, are entitled to rights as individuals. They still retain and maintain all of the rights of being a citizen of this country, of living in this country of the United States, but they also have been afforded rights through state and federal laws. And those rights include having a dignified existence, meaning being treated with consideration and respect, recognizing a person's individuality, being able to exercise their rights without interference or reprisal, and to have access to quality care. They have the right to self-determination, choice in what their day looks like, what their schedule looks like, who provides care for them, including their physician. That's a really important one because so often people don't know that they have the right to choose their own physician. When a person lives in a nursing home, that doesn't mean that they should be just adhering to everybody else's schedules. They do have the right to reasonable accommodation of their needs, their preferences, to develop their own care plan and to be a participant, an active participant in the development of a plan of care that actually reflects their needs, their preferences, and goals. To request and refuse treatment. This is a really important one, particularly as we talk about abuse and particularly chemical abuse, because so often we find that residents may be given medications that they have not consented to or that might not be in their best interest. And they need to know what the challenges are, what the benefits are of the treatments that they are getting, and they have the right to provide informed consent to refuse treatment that they don't think is in their best interests, and also the right to raise grievances without discrimination or retaliation. They should not go into a facility and be afraid to raise concerns or raise challenges, thinking that they might be discharged or asked to leave. They do have the right to raise those concerns and to have them addressed by the administration, by the staff, to find a solution that works for both the resident and the facility. The residents have the right to be fully informed about the type of care that they get, the risks and benefits, as I mentioned, of proposed treatments, and to be notified of their rights and of their care in a language and in a manner in which they understand. I'm so excited that the program today includes interpreters, includes closed captioning, so that we can reach a wider audience and so that there actually is the ability to provide information to people in a manner in which they are able to understand and accept it. And that's something that should be happening in long-term care facilities as well. If you speak a different language or if you need assistance with interpretation as a resident, you have the right to those services. And also access to others is really important, including visitors of their choosing, access to the Long-Term Care Ombudsman program. The Ombudsman program is one of those few people that does have the right to immediate access to residents, and that's an important right that residents have. Also to participate in resident groups like a resident council or to meet with other people in their communities. A note that, you know, when we think about long-term care facilities, generally we think about older individuals that are living in these facilities, but remember that there are people of all ages living in long-term care right now, receiving long-term care and services, and every resident, regardless of their age, is entitled to the same rights as everyone else living in the facility. So with that, you know, COVID has really put a damper on some of the rights. And if we'll move on to the next slide, please, we'll talk about that a little bit in the sense that COVID has really, again, changed the way we all have been operating within this country, actually around the world. And the same has been true in long-term care facilities. We have seen that facilities have essentially closed their doors by direction from the federal government and by the states, where they've not been allowing visitors or non-essential healthcare workers since March. And that's been exceptionally difficult for the residents and the family members. We've seen waivers of rights that have been issued by the federal government, including the notice of transfer or discharge only in the sense if they are being cohorted to provide care for individuals who either are positive for COVID or negative for COVID. But the fact is that generally residents have the right to notice before they're transferred either within the facility or outside of the facility. But that right has temporarily been waived, and that's an issue that I know that has been challenging for a lot of residents and family members in terms of, again, being informed about what's happening to them, about where they're receiving care and services, about having a say in where that is going to be and where they might have to move to if there is a reason for them to go to a different location for services. So that's been one of the waivers, but also there have been waivers to the rights to communal activities. Resident councils have not been meeting in person. A lot of activities have been suspended, including dining or different activities that might be going on in the facility, including the resident council meetings. And that has really impacted the residents' quality of life. We've been because of some of these changes and because of the bans on visitation, there have been real issues with isolation in long-term care facilities because of COVID. And the fact that people have not been able to see their loved ones has been just as impactful as the bans, as COVID actually has. We know that the numbers of residents that have been impacted by COVID in terms of becoming infected with the virus and actually dying or having serious health issues because of it has been extreme. The percentages are higher than any other segment of the population. But what we are finding is that the isolation that residents have been experiencing has been as traumatic for them as the bans on visitation. And so as we talk a little bit more, we'll talk a little bit about the need for advocacy around visitation. Because people have not been going into facilities, because ombudsmen haven't been going in, surveyors haven't been going in, nor family members and friends, there have been real concerns about the care that's being provided. There's real concern about short staffing. We hear a lot of stories about that right now, about abuse that might be happening and the use of chemical restraints in facilities, particularly as residents are being instructed to stay in their rooms, not walk around, not commingle with other people, and that's been very difficult for many, particularly those who have dementia or who may not understand why they aren't able to leave their rooms or aren't really understanding why they need to follow different social distancing procedures or other protective procedures. So we're concerned about the type of care that's being provided in a number of facilities. And so that has been one of the impacts of COVID as well. And then we know as we're going into an election this year, we're just a few short weeks before that, the impact of COVID is really putting a real thorn in the side of residents' ability to exercise their rights to vote in a number of areas, in the sense that some of the help that might have generally been made available to them has not been as readily available, in the sense that nursing homes often have been used as polling places. That's not occurring right now. Outside community members who might have come in to help with registering to vote or helping a person fill out their ballot, that's more difficult because of the restrictions on visitation. But what I will remind folks is that residents do have the right to cast their vote, and the facilities do have a responsibility to help them assert that right, and that should be occurring right now as well. So as we think about looking at some of the concerns that I raised, there are things that we can be doing to prevent abuse, to provide interventions that will support residents, and engagement of residents and families is really, really critical, particularly during this time. And just because you're not able to go in and visit and spend time with your loved one in person doesn't mean that you can't continue to be engaged with them, to know what's going on with them every day. You just might have to sometimes work a little bit harder to figure out what that might look like. But being active participants in the care that's provided, focusing not just on the needs of what the individual requires in terms of their care needs, but also their preferences in terms of how they spend their day and what their schedule looks like, what kind of treatment they receive. all of those things are really important to keep front of mind and to be asking questions about, to stay engaged in the care that they're receiving, to know what it is that they need, so that you can advocate for them as best as possible, to ensure that their needs are being met. Think about the cues of the resident and what it is that they're trying to tell you if they are communicating with you in ways that might be other than verbal. Some residents who have difficulty communicating verbally may communicate with you about through actions or through reactions to through trying to get their message across in different ways where they might not be able to speak to you. And so understanding what those cues are can help you focus on what they are experiencing, whether or not they're receiving good care, whether something's right or not right. Really pay attention to the cues of the individual. So when you are able to go back in, though, and we are now starting to see that there are some access that's being provided to families in a limited way, to ombudsmen, and even to surveyors, it's important to be paying attention to what's going on in that facility and to really look at the residents, to really experience what the experience has been for them during this crisis. Look physically at them. What changes have you noticed from the past couple of months since you had seen them before? Are you seeing physical changes in them, weight loss, for example, or look at, are they clean or well kept when they go in? Look also at their demeanor and their behaviors when you go back in as well, in terms of paying attention to what the cues are that they can be showing. Have they become more withdrawn or more subdued, more anxious or fearful? We do know that residents during this time of COVID are more likely to experience depression and anxiety. How is that being assessed? How is that being treated? And what can we do to support that? But also look at their behavior. Are they lashing out, or are they appearing as though they're trying to tell you something when they're communicating with you, and try to figure out what it is that the person is trying to say in order to meet their needs. We do know that behavior is a form of communication. So if you're seeing changes in behaviors over time, then it's important to ask questions about what that might mean. Know your the residents' signals or cues that they may traditionally have been giving to you. Get to know the person. Certainly as family, you should be knowing the person and sharing information about that person with staff. But if you're an advocate going in, talk to staff. Try to communicate with others who may know that resident to try and assess what it is that that person is trying to talk to you about. It's by knowing the person, it's by staying engaged in their care, by staying in effect, communicating with them on different levels, that you are able to not only prevent abuse, but to be able to intervene if you're concerned about what you're seeing, concerned about issues of neglect, for example, or poor care, or even depression or anxiety that you may be seeing from residents. It's important to be staying engaged and asking questions of them about what's happening and how you can best help. As I mentioned, the visitation is really critical, and so if we move to the next slide, please, we can look at some advocacy strategies that we can be pursuing over this time of COVID and as we're looking at going back in. And this is true for families, for ombudsmen, for surveyors, as we're starting to go back into facilities for visits. Look at ways that you can really engage with as many residents and even other family members as possible. We are seeing a lot of outdoor visits now that the weather is still nice, and we're really hoping that more indoor visits are going to become available as we're moving into colder weather times. We've seen a lot of ombudsman programs setting up tables on patios and courtyards right now to be available to answer questions, to take complaints and share information with residents and families. And we know that families are communicating and connecting with each other in a variety of ways as well. Virtual engagement with your loved one continues to be critically important, particularly for those who are unable to come and visit in person, or for people that live far away. So even if your loved one is not able to communicate by video chat, or if a resident isn't able to communicate by video chat, as an advocate or as a family member, still insist on that video communication if possible, so that you can put eyes on them. That's a really important point right now. Looking at, are they clean? Are they dressed appropriately? You can learn a lot from observing their physical condition and demeanor. And while you're looking at them, be talking with the staff about the individual, and ask questions about how they're doing, how they're spending their day, so that you can look at individuals who might not be able to express themselves and tell you things about their own daily experiences, but you can talk to the staff and you can observe what you might be able to see from them. I know that Joe's going to talk more about ombudsman work, but we've also been talking with ombudsmen around the country who actually have been very active virtually, connecting with families over social media and Zoom. And again, trying to connect with residents directly by asking staff to take phones or tablets with videos around the facility, so that they can actually talk with residents throughout the facility who may not know that they can call the ombudsman, or may not have that direct connection. During this whole process, and I know there are a lot of advocates that are listening in here, there is a real critical need for systems advocacy right now, particularly for nursing home residents and for those that are living in long-term care facilities. There's a real need for continued advocacy around emergency preparedness and response, around the implementation of infection prevention and control practices. We're still seeing that that's not properly being implemented in facilities, which is why the infection rates aren't going down as quickly as we'd like to see them. There's a real need for advocacy around transparency about what's happening in facilities, because not many people have been inside for the last 6 months. It's really critical that there be transparency from others, like surveyors, like ombudsmen, who can get information from nursing homes to find out what's going on. And again, also about visitation and what that looks like in states, because it's been really critical that we try to reunite families and residents as much as possible. And we still have a long way to go before we have full visitation again, but through all of us advocating together, we can find ways to have safe and effective visitation that protects not only the residents, but also the staff. And with that, I'll stop and turn it over to Joe to talk more about the Ombudsman program and the work that they've been doing. Thank you.
Thank you, Lori. Good afternoon, everyone. A quick shout out, we have on our Lunch and Learn webinar today, the 35 local ombudsman program coordinators, as well as staff and volunteer ombudsman representatives from throughout the state. They're joining us as part of our virtual fall conference this year. Thank you for the invitation to join you today. I'm really pleased to be here. I'd like to talk to you today about the Office of the State Long-Term Care Ombudsman as it's established here in California and in federal law. Here in California, the office is established by the Older Americans Act and the Older Californians Act as an independent, person-centered complaint resolution and advocacy program for residents of long-term care facilities. Next slide, please. Our mission is to identify, investigate, and resolve complaints that are made by or on behalf of residents that may adversely affect their health, safety, welfare, or rights. That's a very broad mandate. And you'll notice the Older Americans Act says identify, investigate, and resolve. This means that we don't just sit back passively and wait for complaints to come to us, but rather we identify problems. And we do that in a variety of ways. We make regular visits to long-term care facilities. We meet with residents to discuss their concerns and their problems. We try and make ourselves have a regular presence in facilities so that residents understand who we are and that we're a safe place for residents to come and give us their trust. They can tell us their problems, and they know that we won't do anything with their information unless we have their consent and their direction to investigate a complaint or resolve a problem. In addition to resolving the individual complaints of residents, we also analyze, comment on, and monitor the development and implementation of laws, regulations, legislation, and other governmental policies in action that pertain to the health, safety, welfare, and rights of residents with respect to the adequacy of long-term care facilities and services in the state. Most importantly, we also have the ability to recommend any changes in such laws, regulations, policies, and actions as the office determines to be appropriate. That's kind of unusual if you're working in state government, especially if you're in the executive branch. The ombudsman, because of federal law and state law, has the ability to speak and take position apart from the administration, apart from the Department of Aging. We have an independent voice, a voice for residents. Here in California, state law gives us additional responsibilities that go beyond our traditional Older Americans Act responsibilities. State law requires that we provide regular and timely access to ombudsman services by visiting every long-term care facility in the state on a quarterly basis. That responsibility was given to us last year, and as you can imagine, given COVID, that's been a difficult obligation to meet. But ombudsman representatives have stepped up to the plate. Even though we couldn't provide in-person visits for a time, we did continue to make contact with residents, facility staff, families, through telephonic means, email, video conferencing, and chat. The work continued, and our information and assistance that we provided to facility staff almost tripled over the past year. We also receive and investigate reports of suspected abuse and neglect of residents in long-term care and certain other community care facilities. In most other states, those reports go to Adult Protective Services, the licensing agency, or law enforcement. But here in California, we, along with law enforcement and the licensing agencies, receive and investigate reports of abuse and neglect that occur in long-term care facilities. California law also requires us to witness advanced healthcare directives and certain property transfers for residents of long-term care facilities. Here in California, the Office of the State Long-Term Care Ombudsman is housed administratively within the California Department of Aging. We're an entity that's separately identifiable and distinct from the department. There are in California 35 local ombudsman entities designated by the state ombudsman and housed in either the area agencies on aging or nonprofit agencies under contract or subcontracts with the Department of Aging. In federal fiscal year 2018, there were approximately 820 certified ombudsman representatives who obtained criminal record clearances, completed 36 hours of initial classroom training, a minimum of 10 hours of supervision in the field before certification, and a minimum of 12 hours of annual continuing education. I'd like to point out that nearly 80% of certified ombudsman representatives in California are volunteers. We rely heavily on our volunteer workforce. What are the kinds of problems that residents and families come to us with? Well, the majority of our complaints are around resident rights, abuse, access to information, problems with admission, transfer, discharge, eviction, residents' autonomy, choice, the exercise of rights, privacy, property and financial issues. 23% of complaints in California were around quality of life issues, activities and social services, dietary issues, the environment of the facility. 25% were around resident care, rehabilitation or maintenance of function, the use of restraints, both chemical and or physical. Facility administration, only 3% of the complaints we worked on in the previous year were around policies, procedures, staff attitudes, resources, or staffing at the facility. 4% of complaints that we investigated were complaints against others, the certification or licensing agency, the state Medicaid agency, the system, or others. And finally, 3% of complaints were around complaints in other settings. These could be complaints about outside providers, home care, hospital, hospice, public or congregate housing, not providing personal care, and or services from an outside provider. Next slide, please. So what are some of the types of complaints and issues that we see? Let's talk about some of the stories of residents. And these are stories that we've highlighted in our annual report here in California. Here's one story about Mildred. Mildred had lived in a nursing home for 6 months following the death of her husband, who had been her caregiver. Mildred's daughter oversaw her money and was supposed to pay for her care at the nursing home. Unfortunately, her daughter spent the money herself and did not pay Mildred's nursing home bill. Facility staff contacted the Long-Term Care Ombudsman program for help because they did not want to evict Mildred. The Ombudsman program worked with law enforcement to stop Mildred's daughter from using her money. Other family members are now taking care of Mildred's bills. Let's listen to another story. Next slide, please. Robert. Robert had lived in a nursing home for a year, and due to a stroke, he was unable to move his body and was in bed most of the time. Robert told his ombudsman that another resident was coming into his room and hitting him, grabbing his arms and legs and yelling at him. The ombudsman was able to ensure that facility staff protected Robert from further abuse. Let's listen to one more story. Jennifer had resided in a residential care facility for the elderly since 1999. Eventually, she used all of her savings to pay for the facility. She contacted the Ombudsman program for help to avoid being evicted to a nursing home. The program was able to help Jennifer qualify for state and federal programs that subsidized her care. In addition, the Ombudsman program helped the facility understand licensing regulations that prevent evictions in some cases. As you can see, the Ombudsman program has an important role in protecting residents' rights. We stand with residents, their families, and friends, and help them understand and exercise rights guaranteed by federal and state laws and regulations. When you move into a long-term care facility, you don't give up any of your rights. Residents have the right to be treated with dignity and respect, to be free from chemical and physical restraints, to manage their own finances, to voice grievances without fear of retaliation, to associate and communicate privately with any person of their choice, to send and receive personal mail, to have personal and medical records kept confidential, to apply for state and federal assistance without discrimination, to be fully informed of available services and any charges for those services prior to admission, and to be given adequate advance notice of plans to transfer or discharge them. As Lori mentioned, some of these rights have been challenged and limited during COVID, which makes our role even more important. To advocate, to speak up, and to make sure that to the extent that we can, residents' rights are protected. Thank you.
Thank you, Joe and Lori. We appreciate that so much. And I want to say again how lucky we are to have such distinguished leaders on our webinar today. So at this point, we have time for questions, and I want to encourage everyone to drop those into the Q&A. That will allow us to review them, and we will ask and get through as many as we can today. And for the rest, we'll hopefully be able to record later this afternoon. But I'm going to start us off today with a question that comes from Diane Healy. And she asks, and this is to you, Lori, since Ombudsman Service is a federally mandated program, does that mean if a resident moves from California to a different state, the resident can expect the same type of level and support from the Ombudsman as they received in their home state?
That's a great question. And ombudsman programs exist all over the country. They are required to follow the standards set out in the Older Americans Act, and they are the same all across the country. The services that Joe talked about today are the services that ombudsman programs provide in every state. So in your state, you have access to ombudsman at the state level, like Joe is the state ombudsman. And then there are community-based ombudsmen as well. To find an ombudsman in your community, we have a map, a Get Help page on our website at theconsumervoice.org, where you can find the contact information for the ombudsman in your community. But ombudsmen all across the country are providing information, they're resolving complaints, they are working with you to ensure that you get the best care possible and that your rights are protected.
Excellent. And I would also add that you as Consumer Voice offer training and support so that you ensure that consistency across the country between your not only your initial certification training that's available online, but also the additional webinars and tools available on your website as well.
Mm-hmm. Absolutely. We have support for ombudsman programs across the country, and the Administration for Community Living that oversees the program really emphasizes the need for programs to follow the same standards that are required at the federal level. So you should get similar level services.
Thank you. So this is to, I think probably both of you have different takes on this. And we have a conservator saying, you know, how can I advocate for my conservatee when they are in a facility, when they do become positive, or even before? How can they advocate to ensure that the staff are providing appropriate protections and for the resident, while also allowing some freedom of movement as well? Joe, did you want to start?
Sure. You know, I think a basic premise of ombudsman work is, you know, the first thing you want to do is talk to the resident, find out what the resident's preferences are. What does the resident want? Can the resident express his or her wishes? Even people who are under conservatorship can express preferences, what they want to wear, what they want to eat, what they want to do, what time they want to get up, what time they want to go to bed. Mm-hmm. You know, it's important to listen to the voice of the resident, and even residents who may be impaired in some way. People can still express their preferences and their wishes. And in this particular situation, you know, it's good for you as a conservator and an advocate for your conservatee to talk to the facility, to find out what they're doing to support the resident, what they're doing to allow the resident to express his or her wishes and preferences, and to support that. Lori, did you have something you'd like to add too?
Yeah, I'd just like to reinforce what you were saying about communication with both the conservatee and as well as the facility. They should be sharing with you their plans for protecting the residents and the staff. You should know what they are. And if you haven't received those plans, then you should be asking about it. Stay in touch with them about staffing levels, for example, and how the staff are trained. That is one of the biggest indicators of quality care, also of keeping COVID out, is by having enough staff who are well trained and following proper infection control procedures. So ask questions about those things and know what it is that they're doing. If you have concerns, certainly call your ombudsman for assistance. If you feel the facility is not doing what it should be with respect to following proper standards, then you can file a complaint with the licensing agency in your state as well.
I'd like to reinforce what Lori just said. Staffing is key. The better staffing ratios you have, the better care and outcomes are going to be for residents. People will have time to adequately provide assistance to their residents. They aren't rushing around from resident to resident. They're practicing good hand hygiene and sanitation. The evidence, the research shows that the better staffing ratios you have in a facility, the better your outcomes for residents are going to be.
Absolutely. We have some questions popping up about the website. And so I want to confirm, Lori, your website is consumervoice.org. Is that correct? And they can find all of the resources and tools there?
www.theconsumervoice, all one word, .org, and they can find all of the resources there that I've talked about. We've got a great wealth of information for residents and families, particularly around COVID and what people are seeing now and with respect to visitation and facilities.
Excellent. And I also want to say for Joe, your website is what?
Yes, our website is www.aging.ca.gov. If you navigate to programs and providers, you can find information about the Long-Term Care Ombudsman program. Another resource I'd like to share, especially for those who are on the meeting today who are Ombudsman representatives, Lori's organization, the National Consumer Voice for Quality Long-Term Care, also operates the federally funded National Ombudsman Resource Center. They have an amazing amount of resources and training materials for ombudsman representatives. And you can visit them at www.ltcombudsman.org.
Excellent.
And I'm putting those in the chat for folks too, so they can see them.
Thank you. And also remember, Joe, what's great for the California Ombudsman is he has placed the guidance that he and his staff have created along with the task force around COVID reentry and work on those websites. And so if you're an ombudsman from another state or you want clarity, like that's a great place to look to see how California has undertaken this in a really careful process. So be sure to check those websites out. Now, we have a question from an ombudsman, which I think is so to the core of what we're doing, which is, what do you suggest we do if residents are telling us or we believe that the facility staff are pressuring them to not report their concerns or complaints to their local ombudsman program?
That's a good question. You know, residents are very fearful of retaliation. They're very fearful of speaking up. They're reliant upon facility staff for care. They're reliant upon facility staff sometimes for being fed or being taken to the bathroom or getting a drink of water. And a lot of residents are fearful of speaking up. Even if staff don't retaliate, they don't want to be seen as troublemakers. They don't want to be seen as different. They don't want to run the risk of being disliked or being thrown out of the facility and ending up on the streets. So they remain silent. Mm-hmm. Part of what I was mentioning earlier about our regular presence in facilities is meant to give us opportunities to speak privately with residents. We want to be able to have residents trust us and trust that what they tell us is going to be kept in confidence unless they give us permission to share that information. Ombudsmen from time to time need to ask those kinds of questions. Do you have concerns about your facility? Do you have concerns about the people who are providing care for you? Are you being mistreated? Are you being treated differently? Can you speak up? Can you voice your concerns? If you can't or don't want to for fear, can you let me advocate for you? Can you let me somehow bring your concerns either anonymously or with your consent and permission, with your name, with facility administration and management? And then we don't just abandon residents. We check in on them once we resolve a complaint for them to make sure the resolution has stuck and that they're not experiencing retaliation. So if people see that, they should feel free to contact their local ombudsman, who is in a position to do something to improve their condition in the facility.
One other thing I would suggest related to that, and I completely agree with everything that Joe has said, is, particularly for staff or other advocates that are on the call today, is to remember that ombudsmen are there to assist with the residents and can also often help find solutions when problems are still kind of at the early stages before they get to be really big or full-blown problems. And by having an ombudsman come in and help work on a solution to the resident satisfaction, oftentimes it's something that is amenable to everyone involved, the facility, the staff, and if they find a workable solution. That is a better scenario to involve the ombudsman for most facilities than to file a complaint with the licensing agency, where they run the risk of being cited for a deficiency and facing a potential penalty. So an ombudsman is there to really help support the residents and to find a workable solution for the resident. And we know that a lot of facilities would much rather work with the ombudsman program than to have the surveyors come in and assess them for non-compliance.
You're absolutely right, Lori. So much of what we do is providing information and assistance to residents and to facility staff, answering their questions, clarifying what laws and regulations say, empowering residents and families to take action for themselves and to speak up. And those are all things that aren't associated with complaints or cases. It's empowerment.
Yeah, I think you just hit that on the nail on the head. And I think it's also, ombudsmen don't just show up when there's a problem. We come before there's a problem. So we in some ways become like wallpaper. We might witness the issue the resident's complaining about and be able to speak up on saying we have seen something, or because we're not out to get the facilities, we're out to help them improve care, that we can be sort of a buffer so a resident doesn't feel like they're being difficult or challenging. And I think that is the beauty of ombudsman, is that we, one, work at the behest of the resident, and two, that we are there before there's a problem. So we have this great question that has come up, and Lori, I think this is to you first, which is, you talked about, back in March that ombudsmen were, our entry was limited along with everyone else into facilities. And so she just wants to clarify sort of where are we at in that regulatory process? Has that shifted? Are we still there? And how do we ensure that those worrisome conditions without oversight aren't persisting if ombudsmen are not in buildings?
It's a great question because facilities were locked down tight in March, and no one who was not an essential healthcare provider was allowed in. And in many cases, as I mentioned, that included surveyors as well, who go in to assess for conditions. So we are at a point now where there's new guidance that's been issued by the federal agency that oversees nursing homes, the Centers for Medicare and Medicaid Services, or CMS, where there is some allowance for visitation right now, and that it's being done in a measured way. But that is including family members. It's also including ombudsman programs. Many states have also issued their own guidance around ombudsman access to long-term care facilities. So I would say in the majority of states, ombudsman programs are starting to restart visits again in facilities. Sometimes they're outdoor visits, the same way that many family members have been visiting outdoors. As I mentioned, we've seen ombudsman programs setting up tables on patios to connect with residents and families. But they are also starting indoor visits with residents. So it's important to talk to your ombudsman program, or if you are an ombudsman, to connect with your state ombudsman about what the policies and practices are for ombudsmen to go back into facilities. But it's really important that those visits are getting restarted again right now. But as Joe had mentioned, just because ombudsmen weren't actually going into facilities to handle issues doesn't mean that they weren't working really hard on behalf of residents and families during this time period. Many of them have been connecting virtually with both residents and family members. As I mentioned, calling them on the phone or having video chats with them, doing Facebook Lives with family members, or Zoom calls with residents and family members across the country. So ombudsmen have been very busy advocating. It's just that it's great that they're starting to be able to go back into facilities now.
I agree, Lori. You know, we set an internal goal for us during the month of September to hit 1,000 facility visits throughout the state. And while the data is still coming in, the last number I looked at showed that we made 970 visits last month.
That's great.
So we're very close. We may still hit that goal for the month of September. And you're right. The work that we do has looked a little different over the past 6 or 7 months, but the work has continued. People are putting in very long hours helping residents and families. I can tell you, you know, the amount of calls that we've received from family members and from residents who are so angry and frustrated about not being able to see their residents, and the pain that residents are experiencing from loneliness and social isolation are real. Here in California at the state office, all of our staff have been working remotely since mid-March. And back in August, I had the situation of having to go into the office to check for a couple of things. And while I was there, I had forgotten this, but 2 of my staff were in the office working that day too. And it was the first time I had seen them in 5 months. And I wanted to cry. I mean, I was so happy to see them. And I thought, my God, if I'm feeling this way, how are residents feeling?
It's been very difficult.
It's been impactful, very impactful.
Joe, I appreciate you saying that, because I think it exemplifies how much we as ombudsmen want to be with our residents, and how we're trying to walk a line of making sure we're not a risk to them if we're coming into facilities, but that we're all deeply concerned that no one has been in to visit them, be it family, regulatory agency or ombudsman, in so long. And so realizing this is just a hard time for everyone, and everyone deserves a lot of grace. We have another important question on that point, which is, can ombudsmen be of assistance to conservators during this time when they're looking to place them in a facility? Are we allowed to provide recommendations? How can we sort of give information about facilities while still maintaining our right to confidentiality?
Sure. So as Nicole knows, and as Lori knows, ombudsman representatives don't make referrals to facilities. We don't recommend facilities, but we do provide you with information about what we see, about the types of complaints that we receive in certain facilities. We try and get an understanding of the needs of the individual resident and what that person needs in order to thrive in a community. And we can provide you with information about places that you can look at that might meet the needs of the resident. The key here, of course, is again, individualized care planning for the resident that takes into account the resident's perspective, the resident's strengths and areas of challenge that he or she might need assistance with. And we can be that resource for you in helping to find an appropriate place for your conservatee.
Lori, is that different in other parts of the country? Or have you heard from other ombudsman programs about how they handle that?
I think that's pretty consistent with what we see across the country. Ombudsman programs are good at providing information about helping you think through what your choices are in terms of where to place your loved one. Oftentimes, family members or conservatees or guardians will come and say, I need nursing home level of care for this individual. And oftentimes one of the first questions back is, why do you think you need nursing home care? There might be other options even that might be available to you. And so an ombudsman is a good resource of information and can tell you, again, what types of complaints they receive from a particular facility, so that you can get a better understanding. Also, what type of information is available to you that you can look at yourself, including a survey report, for example. That's a public document, and you can get it on the Nursing Home Compare website. California has a great, lots of good information about facilities that are available in the state. So ombudsman programs and Nursing Home Compare are great places to get information about long-term care facilities so that you can make an informed decision.
Absolutely, thank you. We're coming to the end, but I want to throw out one last question, and it wouldn't be fitting if we had an ombudsman meeting without a question from our local program coordinator in San Francisco, Benson Nadell. And so Benson asked, if a resident in an assisted living is confined to a room for meals under COVID-19 precautions, which prevent group meals or use of common areas, what rights are being violated, and how can we as ombudsman can advocate for that resident if they're not doing so well in that situation?
That's a good question. Benson, you always have good questions. You know, this has been an extraordinary time. And I think, you know, initially out of an abundance of caution, facilities were trying to do their best to isolate and protect residents. And through that process of isolation and protection, we know the experience of loneliness and disconnectedness that residents experienced. I'm hearing reports anecdotally now of facilities reopening their dining rooms with social distancing measures in place so that people can congregate and gather together and talk and be with each other and share a meal and break bread. And I think as ombudsman representatives, that's something that we can advocate for. How can you restore activities? How can you restore congregate dining in a safe way that helps reduce social isolation in facilities?
Mm-hmm. That's really important. So Benson is talking about assisted living facilities. When I was talking about the guidance that CMS had just issued not too long ago about visitation, allowing some reopenings, allowing some reinstituting of communal activities, including dining, the CMS guidance applies to nursing homes directly. So you need to look to your state for what the guidance is that applies to other settings like assisted living. Now, many states are applying the same guidance to assisted living as they're applying to nursing homes. So it's really important to look at that. Your ombudsman can help you with that, or your state Department of Health can help you with that as well.
So we are going to turn towards closing out our webinar, and I want to remind folks of a few things. First of all, to register for next month's event, where we are going to talk about exactly this issue about isolation and how to prevent that. And you can be the first to register by clicking the link that was just dropped in the chat. But before we go and before Joe leaves, I want to make sure to recognize something, which is that Joe has been our state ombudsman for 18 years, and he just had his anniversary, and we did not do any fanfare for him. So I want to take a moment and recognize Joe for all his good work in that time and all of his support. I've been an ombudsman for 10 years under Joe, and I count him both as a mentor, but also as a friend who has been kind and good to all of us during this challenging time. And so I want to make sure that, Joe, you as an ombudsman know how much we appreciate you during stressful. So I want to just take a moment and say that. Thank you, and really appreciate you making this time in your day.
Thank you, Nicole. And I appreciate all of you out there who are ombudsman representatives, the 35 ombudsman program coordinators who lead our local entities, the regional coordinators, the staff, the volunteers. You're all so important and so valuable in helping protect residents' rights, especially over the past few months. So thank you.
Thank you. Well, everyone, we wish you a safe and healthy month. Please continue to protect yourself, and we appreciate all the work you do. We will see you next month. Bye-bye, everyone.